Well, welcome back, everyone. We have Micah Sobota here. He is the Director of Crisis Stabilization Unit for Coleman Health Services. Welcome, Micah. How are you today?
Very well, thank you.
Good, good. Now, it seems like more and more Americans these days are struggling with some sort of mental health and addiction issues. Am I correct?
Oh, without a doubt. Both are always on. It's one of those things that's always been there. But we need to break the stigma with mental health and addiction, and we need to bring this to the forefront and help get this treated.
Yeah, and you're part of the Coleman Health Services, and it does offer quite a few, ways to help, and a lot of people are looking for help. So, can you explain to us some of those services that are offered?
Oh yeah, within a community mental health center, it's not just one thing that can help. We need multiple factors. We need psychiatry for the medications. We need counseling for psychotherapy and talk therapy, and multiple case management to help them get to their appointments, peer support to help somebody be there to help recognize with them. And that's one great thing about Coleman Health Services. We have that whole holistic approach, and that we have it's not just a one-stop shop. We get everything in there in that spot. So one thing that I have that is probably one of the coolest is the Crisis Stabilization Unit, the We Care Crisis Center. And that crisis center is there for us, for anyone battling mental health, addiction issues, maybe not quite sick enough for hospitalization, but we need that respite, we need that break so we can figure out what's wrong. And I think that's one of the coolest aspects that we have in our community, because not every county, not every tri-county, there's very few crisis centers throughout the state of Ohio. And one of the coolest things is the crisis center for our community.
Right. And so for, like I said, a lot of people are struggling, and one of the big things is probably being afraid to just ask for help, I would say. And so a good place to come to is you guys. You guys are the professionals. You're the ones that can help. So if somebody wants to come in and just ask for help, what are the steps there?
Great thing. Within the crisis center, 24/7, 365, you walk in, you get an assessment, you talk to a nursing staff, you get an assessment and see if you're appropriate for an admission, But if that's not the thing, if you don't want to stay at the crisis center, we have that opportunity. Again, we have walk-in assessments Monday through Friday within outpatient services at Coleman Health Services. And you're right, it's a very busy time. If we don't get you in that day, for an assessment, we do our best to get you in as soon as possible, so that ultimately you see a counselor, you see a doctor, psychiatrist, or nurse practitioner to get those medicines.
Right.
By trade, I'm a farmer. Oh, so sorry.
Oh, no, go ahead.
By trade, I'm a pharmacist. I love those medications, but mental health, just like any other disease state, it's not the only answer. You've got to add the medications with the counseling, with your own stress management. Then when you connect all three of those, that's when you get the best outcomes for your treatment.
Where are you located? What is your address that they can come to you and maybe say, hey, I need the help. Well, can you help me?
Yes. We're located physically at the crisis center is at 797 South Main Street.
All right.
Right on the same campus, our outpatient services were right there, 799 South Main Street.
Right.
And those are our physical locations.
And are you open Monday through Friday, or are you open 7 days a week?
The crisis center is 24/7, 365. So you have that very cool outpatient center, just like any outpatient doctor's office. We're a Monday through Friday. We do have some later hours for those working to see providers, but I focus, being the director of the crisis center, the crisis center is open 24/7.
All right.
And physically located there, but one aspect too with Coleman Health Services, it just doesn't end, with coming in. We have what we call our Hope Line, 988, or the Hope Line, which is 1-800-567-HOPE. And that also is 24/7. If there's any questions that you would have with Coleman Health Services, do not hesitate to call that number.
It's good to know that you're just in our neighborhood and just are able to help at any time.
Oh, thank you so much. And we got to break this stigma. There's mental health and addiction is no different than any other disease state.
That's right. Well,
And we got to treat it as those disease states and get the treatment.
That's right. Well, Micah Sobota from the Coleman Health Services, I want to thank you so much for joining us today.
Thank you.
Well, don't go away. We have more when we return.